So welcome to our panelists. Thank you for taking the time out of your days. So I'm just going to ask you first, as my first question, just to introduce yourselves and tell us a little bit about what your day-to-day responsibilities are in your current role. And you might also like to mention what further education you pursued after your degree at York. So we'll start with Dr. Luca.
All right. So I did a Bachelor of Science in Psychology at York. Following that, I did my medical school training at the University of Toronto. And now I'm a second-year resident in internal medicine at U of T. And what that means is that I basically work in the downtown hospitals, mostly at Toronto General, Mount Sinai, St. Michael's Hospital, and Sunnybrook. But as part of the residency, we do rotate between the different hospitals. And I practice internal medicine. And that's a pretty, I don't think a lot of people know what internal medicine is. It's basically, I take care of adult patients who come into hospital with different acute illnesses. So most people who actually come to hospital either go to surgery or internal medicine. If it's not a surgical problem, then you would come to basically the service. So kind of the types of problems that people come in are, for example, pneumonia, COPD, exacerbations, bleeding from ulcers from the stomach, kidney problems, just like basically a wide variety of problems that deal with your internal organs and then that don't require surgery. And I don't know about my day-to-day. I think most people know what physicians do day-to-day. Go in, see your patients, try to diagnose them and treat them. And on top of that, I also do the research on the side, and that's kind of part of the training as well as something that I enjoy doing.
And you have 30-hour days. You should say that too.
And I have, 30. We were just chatting before that. That my schedule is pretty long, and it's part of residency. We usually work about 100 hours per week, and our shifts are, so they're about 12 hours on a regular day, and every 4 days we're usually on call and work about 30 hours, but that's kind of on the side, side point. She just brought it up, sorry.
I really appreciate you outside of that 100 hours making it out here.
Okay. Hi, everyone. I'm Lindsay Porter-Hall, and I'm a speech-language pathologist at Humber River Hospital. And I work with, actually, I should start with York. I came to York and got a BA in linguistics, and then went on. I actually did a college program after that to become a communicative disorders assistant, which is basically an assistant for a speech-language pathologist. It's a one-year program. And then I worked as a CDA for 3 years, went back to grad school to do my master's in speech-language pathology. I actually went to the States to do that. I went to Edinburgh University of Pennsylvania, and it's a 2-year program there. And now I work at Humber with children 6 and under. Day to day, it also involves a lot of assessment and treatment of speech and language disorders. So that could be, speech disorders are if children can't say specific sounds like S or R. Language disorders, so if children are having trouble with their vocabulary development or sentence structure and that kind of thing. Or also fluency disorders, so stuttering is a big thing we do as well. And part of my role, in addition to assessment and treatment, is consulting to other professionals. So we spend a lot of time on the phone with teachers, for example, or other healthcare professionals. And then also my role, within my own organization. So at Humber, for example, I was part of the accreditation team, which just means you go to a lot of meetings to make sure that the hospital receives accreditation, and mentoring students from grad school and all those kind of hospital-based roles. But that's it.
Thank you. Jen, would you like to introduce yourself?
So I did York twice. I didn't go somewhere else after. I did my kinesiology degree at York, and then I went in and I did some personal training, which is what most people do, for a while. And then I came back to York to do my athletic therapy. day-to-day is all over the place. I work with a hockey team. We're going to Indiana tomorrow for a hockey tournament, and work with the York track and field team. So I'm with them at all of their races, and also one day a week here at Tate doing treatments. I work in a little place in Toronto where I do some personal training still and treatments. So if some of my clients are injured, or if they're sore, maybe they're doing some exercises and their back's a little achy, we can just sort of go onto the table, do some treatment, back to the exercise, and kind of flow back and forth with those guys. A lot of runners and hockey players is sort of my big thing. I also work at a hockey training center just north of here in Gormley, where it's the same sort of idea when the guys are working out. A lot of NHL, OHL guys that they get injured, they just kind of flop onto the table, get treatment. It's not very structured, just not set appointments necessarily unless they really need it. So it's a bit of driving around, but it's a pretty fun, fast-paced career that kind of helps. You can treat someone, it's really a track meet, I treat someone on the table and then send them right out and they maybe win a race or whatever. So that's kind of fun that way.
That sounds rewarding. And Mary is here too. Thank you so much for joining us, Mary, and I'm sorry about the trouble it took to get here. Mary is a senior analyst at Indicator Research and Development with the Canadian Institute for Health Information, and we're very pleased you could join us. So the other panelists have just introduced themselves, and they've mentioned what they'd studied after York, and then talked a little bit about what they do day to day and their day-to-day goals.
Okay. So I actually graduated from York in 2009. I did my degree in biomedical science. And then in my fourth year course at York, I did a thesis-based course, which made me realize I really had an interest in research. So after that, I was looking at graduate schools. And then I looked at graduate schools related to pharmacy, and I found that U of T had a graduate program in pharmaceutical science at the Leslie Dan Faculty of Pharmacy. So I did a Master's of Science at U of T. And then I specialized more in the epidemiology aspect of things, the public health sector, looking at diseases in a population. And then after that, I got a job at the Canadian Institute for Health Information. So day to day, it's very different. We do everything from building indicators to client support, and our focus is really a pan-Canadian focus. So the idea is let's develop these indicators which hospitals can use, but compare them in such a way that even that small hospital in a very rural setting can be compared to a UHN. So that's what we look at.
Okay.
Yeah.
Thank you all for your introductions. My next question is, how did you decide on which further education program to pursue after you graduated with your undergrads? Maybe we can start with Jen and work our way this way.
Sure. When I came out with kinesiology, it's sort of a broad scope, and you can do anything. And didn't want to work in a gym. That was the last thing I wanted to do, but there was a job available, so I went and worked in a gym, and ended up liking it more than I thought I would. So when I was training my clients, I realized there was a gap between sometimes if they get injured or if they're just like, yeah, my shoulder's a bit tight, I didn't have the knowledge base or the legal base to kind of go through and do something about it. So I looked around between physio and athletic therapy and kind of thought about it, and then went back, and that's why I went back and did, so I could just take it that much further and do a little bit more with my clients, and it's changed my career more than I thought it would. But it made me a better strength coach and has opened up a lot more doors.
I came to York doing my undergrad knowing where I knew in high school that I wanted to be a speech therapist. So I came into York kind of hoping that linguistics would get me there. And it did, with a few kind of minor adjustments. But yeah, I kind of knew right away, so.
Okay.
I also thought about medicine for a while since high school, and then came into York thinking I'd like to do that. I decided to do psychology because I, at that time, was very interested in learning a little bit more about the brain and I guess the neurobiology behind different things. And then in med school, I decided that I just re-explored all different parts of medicine and decided that maybe seeing patients that have neurologic problems or psychiatric problems was just not what I wanted to do day to day. So that's why I chose, in the end, internal medicine. But one of the nice things about medicine is that you have a lot of opportunities in that you don't, there are people who, so first you can choose any subspecialty once you're in medical school, and then even in internal medicine, I can then decide to subspecialize in something like intensive care unit or cardiology. I can still do something more specialized if I want. And in medicine, you can also decide you can do a lot more teaching. You can do research as well. So there's a lot of opportunities within the field as well.
Okay, so you had a lot to choose from.
Yes, I still have choices. So.
It's not over.
So mine was a little different, I guess. So I entered York wanting to go to med school, and there's always that one professor, biology first class, that tells you put up your hand, and the person next to you and the person next to you, they're not going to med school. So that I went in with the idea of med school, and as I progressed through by third year, I didn't really want to do med school. I realized it wasn't for me, and then I looked into pharmacy. So I still wanted to do the healthcare professional role. But then at the time, the only two pharmacy schools in Ontario were U of T and Waterloo. And I didn't want to study outside of Ontario. And I didn't get into the pharmacy program at U of T at the time. So what I did was I looked at the graduate programs because that was of interest, and I looked at the pharmacy faculties. So I figured once I finished my Master of Science in Pharmacy, then I would get into the pharmacy profession after that. Once I was in the pharmaceutical science program at U of T, I realized again that wasn't for me. So I was realizing more and more that research was more of my interest. And I guess part of my advice for future students going into grad programs, etc., is to really keep your options open. You never know, you can come in with one idea and then you can leave with a different idea. But the courses definitely enable you to realize what your interests are and what suits you best. And again, the whole idea is whenever you keep those options open, you have more of variety around you, and then you also have the experience of your classmates around you to enable you to choose that as well.
Okay, thank you very much for that. And the next question that I have is, what are some of the lessons that you learned during the application process to each of your programs? What sort of challenges did you have, and is there anything that you would have done differently next time? Would you like to begin?
Sure. Do you mean the program at York?
With your post-York education.
Okay, with my post-York education. One of, I guess, the biggest challenges I had is being able to really dig into the research topic you want. Being able to establish the research topic you want, and then the biggest challenge of all is convincing your committee members that this is great work, that it's never been done before, and it's important to the career field. That being said, I guess part of the idea too is York kind of pushed me in that direction of being able to do that because of the courses I took here. And so you get that practice, so going into grad school, you already kind of have that experience of being able to have a committee and convince that committee, and being able to have the skills to really pursue research.
And do you have any recommendations or advice for someone who'd be interested in applying to your program for the application process in general?
Yeah. So I would say when you're writing your application, when you're writing the essay parts of it, really take the time to do it. They're looking for, I guess, unique individuals from unique backgrounds. They're also looking for really your interest and seeing why you're the best fit for the program. There's a lot of people who want to get into these programs, but the idea is, are you going to contribute something? Are you going to bring something unique to the program? Because the students you study with are really, the cohort of your class is really what makes the program and what makes the degree and what makes your experience in school. So I'd say start early. apply as early as you can and start building the connections as well. So with faculty members, send out the emails letting them know you're interested. That's one of the things that I was taught in my 4th year class at York, that to really approach faculty, let them know your interest, and really personalize those emails when you send them out. And obviously face-to-face meetings are the best thing as well.
Okay. Simina?
So in terms of applying for med school, I think, it's a very tedious and difficult process, and I think most people know that. I guess advice, so I would say the most important thing in the end is having good grades. So consistently doing well throughout your whole undergrad is really the most important thing, because that's kind of the first thing that they look at when they look at medical school applications. And really that's, now going through medical school and being a resident, I kind of understand why that is. Medicine is really memory intensive, like you need to memorize a lot of things. And I think that they just want to make sure that the people who go into medical school are prepared to work those 100 hours and would be able to do that. I think that's why the first cutoff is really high marks. Also, it's a competitive field, so they have a lot of choice, so then they're going to choose the people who do have high marks. So I think that's probably the number one thing, consistently get good grades. I know it's much easier said than done, and everybody does have bad days, but it is what it is. So that's probably one important thing. And the second thing I would recommend is, so as part of your medical school application, you need to demonstrate it. On top of that, you've had some sort of experience that relates to medicine where you've learned something that makes you a suitable candidate. So what I mean by that is you should have some sort of experience in the healthcare field, like volunteering in a hospital, knowing a little bit about what medicine is, what it is to work day to day in. Or other experiences like research in the healthcare field, whether it's your thesis program or something you do in the summer. I think all of these things kind of make you more well-rounded and more of a strong applicant. I don't think there's any key to all of this. I think it's just having all of these things and then having reference letters that also support that you're good and that you want to do this. And the only way to get reference letters, again, is being involved in this and being outspoken when you're doing these activities. In terms of for example, if you're volunteering in a hospital, don't just do the hours, but actually try to figure out what it is that physicians do day to day, and then start talking to the nurses, the physicians, the physiotherapists, the people around, because somebody will have to write you a reference letter, and they should know that you should learn about what they do, and then they should learn about you. So, get involved in different, these are just examples, obviously there's plenty of other things you can do, but those are, whatever you end up doing, be committed to it and then show interest, and then that will go into your application. So high marks and the rest, basically. It's not an easy process. And then even if you don't get in the first time, don't be scared to apply. If medicine is what you want to do, if that's really what you think that's gonna make you happy, then just keep pursuing it, keep trying. I actually have a friend who didn't get in 4 times in a row and then got in the 5th time. So I know it's a bit of an extreme example, but she's going to be a physician now and she's pursuing her dreams. So.
Very similar actually for allied health professions as well, in terms of the application process. Grades, of course, are probably the first thing they're going to look at. And then as well, the volunteer experience, not even just volunteering within that field, but just, they want to see on your application that you're the well-rounded individual who's been involved in a variety of activities. And, I think a challenge for me was I don't think I was as involved as I should have been while I was an undergrad. And I didn't get into grad school the first time. So my backup plan was to go to be the communicative disorders assistant, which I did, and worked for 3 years. And that, in the long run, benefited me greatly because I was still involved in the profession and I got to meet a variety of people in the profession. I worked with speech language pathologists, so I learned so much from them. And, I'm in my job now because of a connection I made through that program. So you just never know what's going to happen. So like you were saying, keep keep trying. I knew I still wanted to go to grad school and pursue being a speech language pathologist, so I did 4 years later, and still didn't get into U of T, but my third backup plan, I went to the States for school, and a lot of Canadian students are doing that now. So, it's just explore all of those options, because, in the end, I'm where I want it to be. So it doesn't always matter, and part of the journey is how you get to your end result. So I think in terms of advice for right now, just the grades, get involved, and make sure your professors know who you are. That was an issue when I applied to grad school 4 years after leaving York. It was like, how do I go back to York now, 4 years later, to ask for letters of recommendation, because it's a big school. So just try as much as you can to get your name out there and your face out there and connect with professors. Yeah.
I think it's the same thing. I don't think marks they're important with athletic therapy and those professions, but not as much as going into your doctorate and so on. But connections is probably the biggest thing. When you're finished with kinesiology, or you can go into athletic therapy concurrently once you're a kin student. Sheridan College also does athletic therapy. So some people do York, and then they do the program at Sheridan. But you need to get in on some. You need to have reference layers, and you need to have some experience. They don't like to take people who have just done kinesiology, who've never worked with a team before, been on a team before. Have you ever touched anybody, like stretched them before? And I think those are really important skills to have. Even some kids that come in struggle a little if they haven't had a lot of experience. So going to a clinic, going with a team, shadowing someone. Do I want to be at the sports field until midnight clearing up stuff? Do I want to be back again the next morning and getting ready, it's kind of a dirty job in a way, but it's if you want to do it, then it's great. So I think the same thing, sort of figuring out what people are doing, like what is their. Then there's different ways of doing athletic therapy. You can be just in the clinic. So do you want to be just a clinical therapist? Do you want to be on the field working with sports teams? Do you want to do both? Do you want to be at a university? Do you want to be at a high school? There's some people at high schools. So I think and then the more people you know, the more, I've gotten a bunch of different jobs in the last little while and not handed in a resume in like 5 years. So it's all on connections and who you know. It's never, resumes aren't important always, so that's who you know. Yeah, really, and you got to keep your nose clean, right? You just got to be nice to everybody, and yeah.
Yep. So while I was at York doing my undergrad, knowing that I wanted to pursue graduate work in speech pathology, I volunteered at a number of clinics offering speech pathology, where I worked with communicative disorders assistants, so they're speech therapy assistants. So I learned, I didn't know about that role before, so I learned about that role through volunteer work, and then just looked into it more, and even before applying to grad school, just to see if it was something, like what was involved. And basically it's very similar to a role of speech pathologist. We just, as a CDA, you can't assess, but you would work with a speech pathologist. The speech pathologist would assess the client and then write all the goals and therapy treatment plans, and the CDA can carry them out. So, this is very specific to my role, but you can kind of look into it. There are other health professions that offer similar roles. So allied health specifically, there's an occupational therapist and an OTA, an occupational therapy assistant. There's a physical therapist, there's a PTA, physical therapy assistant. So it's kind of a stepping stone if you need it. You can kind of look into those options.
And they tend to be like what, and they should be done at more college level? How does the
I
patient
think
fare?
so. My program was a college diploma, 1 year. So it's real, in the grand scheme of things, it's not a big time commitment, and you end up getting a lot out of it. You end up working in the field
And how does
as
the
well.
pay
It was probably about 70%,
Oh.
what I make now.
And it's interesting that you mentioned that you found out about this role through volunteering.
Yeah.
So it's such a great way to learn more
Mhm.
about your field if you find ways to get involved by volunteering in advance or getting those part-time jobs, just so that you can get a taste for what the industry is actually like and find out what
If you even like it, yeah.
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 Yeah, so I'd say there's a lot of rewarding parts of medicine, but I think the difficulty of medicine is the amount of time required to spend at and work. I think that the family life does obviously, like you don't have enough time in your week to be able to do as much as, you don't go out as much, you don't spend as much time with your family, and that's kind of the sacrifices that you take. And I think that going into medicine, it's important for you to know whether that kind of lifestyle is what you want, because medical school is like that, residency is like that, and I say most physicians are really busy. There are some opportunities if you're a family doctor to work part-time, but otherwise most other physicians are quite busy, and they still work about, maybe not 100 hours like we work in residency, but probably 60 hours at least. So 40 would be a normal job, right? So at least 60, some people 80, and we work about 100 usually. So I think the part of it, the way to do it is just we don't sleep as much, and I drink a lot of coffee, more than I recommend my patients drink. And yeah, I don't get enough sleep. I don't exercise as much as I want. So there's personal sacrifices that you make for it. On the flip side, though, it is a very rewarding job, so I wouldn't change it. But there are, that being said, there are days where I'm just I'm so exhausted. I don't want to do this anymore for that day, and then I get good night's sleep, and then I'm like, okay, I'm excited to do this again. I love what I do. And then you have one patient that you've diagnosed or has crashed in the middle of the night. Something bad happened, and you were able to fix it, and they're well the next day, and that just kind of relieves everything and just makes everything so much better, and you kind of forget about everything. And then in terms of the long hours in hospital, I think because you're constantly you're always being asked to do something. It's not like you have time and you're bored and you're kind of sleeping. You're always just asked a question, you're doing something, you just kind of get you're active, and so you have adrenaline and you're up and doing things. I think you just learn how to work like that. But it's definitely a sacrifice you need to consider when you're planning your life.
Yeah. How much would you say you sleep on a...
I'm really worried about this.
Should I be honest? Yeah, probably between 5 or 6 hours a night, probably. So it's not
But, yeah.
Um,
There are days
th-
when you can compensate, right?
So sorry, that's on a regular basis, not when I'm on call. When I'm on call, I don't sleep at all that night. It's basically you go through most of the nights without sleeping. But
What would your typical day look like if you're on call?
if you're on call, you start at 8 in the morning. You round on the patients. For example, if you're doing general internal medicine, you round on your patients. You have new patients that you admit from the emergency department. And then around 5 is when your call starts. The rest of your team everybody else leaves. And then you're by yourself taking care of the 30 patients that are in hospital, and then new admissions you get from the emergency department, and you just see new patients throughout the whole night because people just keep coming in the emergency department, and then around 10 so around 8 the rest of your team comes back. So you basically work throughout the night. Around 8 in the morning the next day, the rest of your team comes back. You talk about the new patients that have been admitted to your team, so they are familiar with them. And then you have to do a little bit of a few other things to do to tidy things up. You need to make sure that you've ordered all their home medications. You need to make sure that they had the MRI scheduled and other tests like that. You consult other specialties, and then you basically leave around 11.
So basically,
12.
You work for 24 hours plus, 8 to 11 is 3 hours, so you're working for 27 hours straight.
Yeah.
No problem. Do you use a lot of nutrition in that? Is there ways of eating throughout, and if you find you eat well and you don't eat well?
So we used to be able to eat okay, but now they made the new hospital policy is not to eat, which is good, not to eat at any nursing stations or anything like that. So it's getting a bit tough, but
Yeah.
the hallways and the snack bars are good.
Yeah.
No, and to be honest, when we're on call, we do sometimes have dinners, we order in, and So it can also be really fun.
Sometimes you get to eat dinner.
Yeah. But there's really no reward that's bigger when you help than helping somebody. I know it's very cliche, but really, I can't even describe it really. But
I think I can't speak to the other ones, but probably with the real hands-on is people skills. Like, can you talk to people, relate to people, understand them, listen? I know listening is a big skill with a lot of when you're dealing people to people. I think that's something that they're looking for sure.
Yeah, I would agree. Yeah, just definitely social skills. If you want to work in a profession that's very hands-on, you need to want to be around people all day long, and just being compassionate. But also, I know for my role, just again sounds cliche, but being very organized. Like, you have to just. My role is very independent. I don't have. I'm the sole SLP at my site, so I don't have a lot of people to go to and ask if I have questions. So I need to be resourceful, and if I'm not sure of something, I need to know where to get that information, and then and just know where I need to be at all times. And yeah.
yeah, I agree. I mean, medicine's a very people skills. Like, you basically need, or when you're interviewing, I think that it's important to show that you're able to, be around people and communicate your ideas and to be empathetic. I would say that's probably the same.
Yeah, and I completely agree with that. I mean, communication skills, being able to relate to others, even when you're sitting, and you're being interviewed by a professor, or even in your job interviews, understanding who the person is in front of you and what they're looking for, and making sure you address that. Part of the other thing too that I think is important, maybe it's not so much that they look for this type of personality, but it's how you how they perceive you. So the idea of going in confident, whether it's you standing in and presenting your thesis, or whether it's you at your job interview, or whether it's you in the workplace, it's really being confident in your skills, being confident in who you are, and being able to show others that as well.
Even if you're not confident.
Right?
Like,
It's
make it seem like you are.
Yeah, you can be confident even if you don't know the answer. You can still have a confident way of addressing the issue,
sure.
right? Yeah,
Because if they
I'm not really sure. Let me find that
yeah.
out. And
Right.
Yeah.
Because I think if you kind of portray that, I don't want to say weakness, but oh, I'm not sure.
I would
then,
imagine it's the same in the ER. Like, if
Yeah.
you go up and you're just not sure and you're very standoffish, it probably doesn't give the patient a lot of confidence.
Yeah, I think honesty is pretty important as well. Like, I think you need to be confident, but if you don't know something, just admit it.
Right.
Admit it and just say you're gonna find out or
Yeah.
figure it out.
Yeah.
And asking a lot of questions I find is very useful. I've never been in a situation where asking a lot of questions has been frowned upon. So really, putting your ideas out there, making sure you get the answers you need. And I think someone said earlier as well, being independent in the sense of you're able to get those answers too. And it's an idea of you're not just going in, asking a question, not knowing what the answer is, but you're going in, having an idea of what the answer is, but also exploring other options, whatever the means of what you're doing.
The problem solving.
Yeah.
Yeah, that was your first question, right?
With regards to funding, sorry, I'm just going to talk about how it works, I guess, with the program I did. So there was a stipend available. So with every year you were pursuing graduate studies, the university gave you kind of like a living expense. So that was the stipend. You're able to make more money through teaching assistant roles. So TAing these courses was additional. And then as well, the scholarships and programs and opportunities you apply to. So the Canadian Institute for Health Research, that's kind of what funded the majority of my graduate program and my graduate studies. So again, there's always opportunities out there, and you just work, I guess, with your professors to really see what's best and what you can apply for. And again, understanding what you're applying for. So if you know, really your chances of getting something are nil to none, whereas for another opportunity, you're hardly anyone applies to this scholarship and it suits you. Again, understanding that, being able to really figure out what's the best use of my time, because you do get busy and you can't apply to everything out there. But that's just my area.
In terms of funding for medical school, so medical school is really expensive. It's about, in Canada, it's about $20,000 per year. A little bit more, it kind of increases every year. But I mean, most people use OSAP to pay for it during medical school. So usually OSAP gives you about half of the money, and then the other half, most people get a line of credit to pay for. There are some opportunities at different schools in Canada that they give you some stipends if you can show that you're, you know, that you're not a high income family or yeah, so there are stipends usually for a few $1,000s per year that they give you. It is expensive, and you do end up having a pretty big debt once you finish. If you go somewhere out of Canada, it's even more. So that is kind of the downside of it. And unfortunately, as a resident, you still don't get paid. You get paid very little, despite working so many hours. And so I can say, I think that you need to finish residency to be able to then, most people like still are in debt when they're residents, and then only finish paying everything up once they finish. So it's a long run.
But you save money on food.
You save money on food because you don't eat. Well, you actually eat junk food from the cafeteria, but so yeah, financially it is a bit of it's not like and the other thing is, it's not like you can have a part-time job. The one thing you can do in medical school is you can have research jobs during the summer, and there are certain like funding opportunities for those. But that's usually for the first 2 years of medical school. After that, you really can't. Like, there's no way to work another job.
For myself, same thing. I went out. I went to the States, so I couldn't get OSAP to go there. So for the first year, I did have to use a personal line of credit from the bank, and then after that, you know, you can in grad schools, at least at the school I went to, they have basically part-time jobs in the university that grad students can apply to. So I was able to do that. It's not a lot of money, but it helps. And I think it covered, you know, the cost of a few courses in addition to an hourly wage. And then I applied for a few scholarships in my second year as well. So combination of those things.
Yeah, I did, because I was a personal trainer, I was able to, your hours can be pretty flexible, so I would often work 6 a.m. till 9 or 10, and then go to school or go to a placement when I worked. I did an internship with the Toronto Argonauts, so I worked 6 till 10, went out to Mississauga, worked from 11 to 8, and then came back home and worked again. And so just worked a lot, but I did a line of credit also, and then worked. But the students at York that do athletic therapy, their placements are paid. You do get something back because it's a work study.
I wouldn't know to tell you the probability. I think it's about 3,000 students applying per year in Ontario, and there's, I don't remember how many hundred spots. I know there's about 300 at U of T. Like, most people do get in. If I were to look at my class, I would say the majority of people got in after 4th year, after finishing their graduate degree, and about, like, I don't know, 30% of the people in my class had either a master's or a PhD, and then got in. So my Bachelor of Science in Psychology was actually quite useful. Medicine is its own thing that you have to study, which is why you have to go to medical school for another 4 years. But I did find a lot of courses that I took in undergrad to be useful. The courses that I took in psychology, and I did neuroscience of behavior, courses like that I did find useful when I was studying psychiatry. And then I took quite a lot of courses from the kinesiology program, actually. There's one physiology course, there's an anatomy course. So I found those to be quite applicable when I was going through medical school. So not all courses are applicable, but some of them are. And then on top of that, in your psychology degree, you have to do statistics, research methods, and a thesis. And I found that to be applicable to me pursuing, like, continuing to do some research throughout medical school and now as well. So there's quite a number of courses that are actually applicable.
I use everything from my kinesiology. I didn't think I did at first, but the more I've taken a few extra courses as along the way, I think I remembered more than I thought. And then the more that something comes up, I'm like, oh yeah, I remember that. Like, you know, and yeah, I use it all the time. Yeah.
For myself, I did linguistics, and I think in hindsight, I think I would have been better off doing like a minor in linguistics, minor in psychology, perhaps. Definitely, I use linguistics. There's no doubt about it. But I think going into grad school, I would have liked a little bit more of a perspective, even education-based or something, just to make me a little more well-rounded. But hindsight is 2020, so.
Yeah, I did my minor in psych also, and I feel like I use that a lot, just dealing with people. Yeah.
But I mean, that's not to say don't be scared if you're in fourth year and it's like, oh no, right?
Yeah.
But because that happened, and I did have to come back and take a few courses here and there. Like I needed, like after I graduated, I had to come back and take like a physics, and so that, you know, that might come up. But if it's just a course here and there, then it's not a big deal, really.
Sorry, just to add something to your point, it doesn't matter for medical school what undergrad you do in the end, because they teach you everything from the beginning, but things are useful, like that you studied.
Mm-hmm.
And for me, I would say my third and fourth year courses, so the more specialized they got, I haven't used them. So because I went, you know, we were learning, I remember third and fourth year, like all, you know, the transport systems in the cell. So you don't really need to know that with what I pursued. But the idea, I mean, the positive and the great thing that came about from that was that I stood out, like I was unique in that sense. So I had that biomedical science degree, but I really wanted to do the epidemiology of pharmaceutical science. Where it did come in handy is just the idea of knowing like how a chemical works in the body. So with that one course that I did take in my grad program, it was useful there. But I would say don't be afraid. Like even if you did an undergrad that you may not think will be applicable to grad school, that's never the answer. You will apply something you've learned. And there's always going to be a learning curve, I think, wherever you go. But every experience helps, and every skill set you have will just continue to grow.
Mm-hmm.